As you know, for several weeks, my administration has encouraged the governors to leverage unused testing capacity in states. Very few understood that we have tremendous capacity. Then 1 week ago, we provided each governor with a list of names, addresses, and phone numbers of the labs where they could find additional testing capacity in their states. Within 48 hours, the number of tests performed across the country began to absolutely skyrocket. On Saturday alone, more than 200,000 test results were reported, which is a gigantic number, bigger than any country anywhere in the world for a much longer period of time. A number that is an increase earlier in the month when we tested roughly less than 100,000 a day. So we much more than doubled it, and that will be doubling again very shortly. We are continuing to rapidly expand our capacity and confident that we have enough testing to begin reopening and the reopening process. We want to get our country open, and the testing is not going to be a problem at all. In fact, it's going to be one of the great assets that we have. Today, we're releasing additional guidance on testing to inform the states as they develop their plans for a phased and very safe reopening. Our blueprint describes how states should unlock their full capacity, expand the number of testing platforms, establish monitoring systems to detect local outbreaks, and conduct contact tracing. We have it all. Other countries are calling to find out what are we doing and how do you do it, and we're helping them. We're dealing with a lot of countries helping them on testing, just like we did on the ventilators. I directed our Medicare program to make it easier for seniors to get the testing that they need, and the pharmacies, as you know, we are allowing pharmacies now to do testing, and we have other testing locations that we're going to be allowing also, but having pharmacies get involved in testing is a very big deal. We're also asking governors to do the same in their Medicaid program, so they're going to be able and authorized to do the same in Medicaid. So that's a big deal. So we're deploying the full power and strength of the federal government to help states, cities, to help local government get this horrible plague over with and over with fast. There's tremendous energy in our country right now. There's energy like people haven't seen in a long time, a spirit that they have not seen, and we're doing very well, considering what happened to us and considering if you look at what happened to others. This is something that the world has not seen for a long, long time. You can probably go back to 1917, where it was a terrible period of time. You all know what happened in 1917. That's over 100 years ago.